Hi, my name is Alejandra Ponce, and in this video I'm going to be explaining how to do a blood transfusion. So I will start by checking my doctor's orders and see what he ordered. In this case, he ordered a unit of packed red blood cells, and I have an order to do a cross match, type and cross for units of the red blood cells. So the phlebotomist would come take the blood sample, take it to the blood bank, and they will take care of that. In the meantime, I would come in to the patient's room, knock, foam in, sanitize my hands, and I would introduce myself to the patient and identify my patient against my marks in the armband. And so I do my patient identifiers, and then I'm gonna assess my patient. So for that, I've already before I do assessment, I'm gonna confirm that the patient did sign consent for receiving blood, and that the doctor did explain everything to him. And once I verified that and see that I do have the signature from the patient and I was a witness and I signed it too, make sure the patient doesn't have any additional questions. Do you have any questions?
No.
Okay. If he were to have questions, we would have to call the provider so that they can clarify anything. So now that we have our paperwork clear, identified our patient and make sure that the consent, now we're ready to assess. So I already washed my hands and I'm gonna put my gloves on. I'm gonna check the head block. So I'm gonna come here, first inspect, make sure there's no phlebitis, infiltration, extravasation. I will feel it. It's not warm or cool to touch. There's no drainage, no signs and symptoms of infection. It looks okay. So what I'm gonna do now is I'm gonna check patency of it. So I'm gonna grab my flash and I'm gonna open it. First I wanna clean my port, and then I'll open my flash. I'm gonna connect it. Oh, it'd be connected right there, and then I would just aspirate, check for blood return. As soon as I see it, I don't let it go into my flash, and then I'm gonna flash it in the push-pause method. So I push, pause, and so I didn't feel any resistance, so that means it's patent. So I'm gonna remove it, and I'm gonna close it. And so it would be closed. And so now that I've checked patency of the head block, I would go ahead and hang on my normal saline bag. So let me hang it. Sorry, having technical difficulties. It's not staying. Well, I would hang it right here, but it's not staying because this there. So next, once I've hanged it, I'm gonna take out my tubing from the bag, and the first thing I'm gonna do is I'm gonna clamp all my ports. This is not a real wide tubing. We made it up for purpose of this video. So I'm just gonna verbalize what we would do. We would clamp all the ports, and then I would spike with either one of the chambers. So I'm gonna go ahead and spike my normal saline. And then I'm gonna fill up the chamber, and I'm gonna unclamp, and I'm gonna spike the tube. For that, I will need to loosen up the cap at the bottom, and then I would let it run and prime all the way until there's no more bubbles, and then I can clamp it now, and I'm gonna connect it to the machine. Just set it up in the machine, and then I'm gonna connect it to the patient. And so I would connect it to the patient. So it would be connected, and then now I can set up my machine, and I would just put it at 5 milliliters an hour just to keep the vein open while I go grab my blood to the blood bank. So I leave my patient, and I'm gonna go to the blood bank. And I'm gonna take off my gloves and sanitize and grab some gloves to bring my blood bank back from the blood bank. I'm gonna grab my forms, and then I go to the blood bank. So once I'm in there, the blood bank tech will be in there. So I'm gonna put my gloves on because he's gonna be handing the blood to me. I don't want to get any fluids on me. And so he's gonna take out the blood bag, and I'm gonna have my Mars and my patient information, and he's gonna check. We're both, he and I are gonna check that I'm getting the correct blood for my patient. And so we're both gonna be checking against the package and information that I have here, the blood bank slip. So we're gonna be checking to see that we do have the correct unit number, that blood is the correct type for the patient. It's B negative, it's B negative, the name is the same, the name is the same. So we're gonna be checking against each other for everything, and then the expiration date, and that it is red blood cells, it is what the doctor ordered, and the correct date of birth of the patient, that correct MRN number. And once we've checked everything against each other, there's no discrepancies, we are now gonna fill out the blood bank slip, and the tech will sign it, and then I will initial it too, and I'm ready to go back to the room. So now that the tech has signed it, he will put the blood in the biohazard bag and hand it to me, and then I will take it back with me to the room. Important to know that from the moment I grab the blood from the blood bank, I only have 30 minutes from that time till the time of infusion. So I come back to the room, and I would foam in and tell the patient I'm back with his blood, and I would have to check again. So for these, I will need a second nurse to come in and check with me as a witness that we are giving the right product to the patient. So I would call another nurse and check against each other and against the patient's armband. So we'll be checking the same information that we checked in the blood bank. We'll check the unit number, we'll check the blood type against the record, and then we'll check that it is red blood cells, a correct name against the blood band, the correct date of birth, the correct MRN number, and expiration date. So everything matches, and the witness is there to see it. And now she's gonna sign the other this other form, and which is this one. And so she's gonna sign it, and I'm gonna sign it too, certifying that we are giving the right blood to the right patient. There's no mistakes. So now we are ready to hang our blood. So I would wash my hands, put on new gloves, and I'm gonna hang my bag now. Okay, and now I'm gonna back prime my second port. So I'm gonna carefully grab it. Like I said, it's not a real white tubing, so it's really hard to keep it clean. So I'm just gonna verbalize. So I would clamp, and then I would unclamp this one, and unclamp this one, and back prime it, the second port. And once I back prime it, I am gonna clamp it again, and then I'm ready to spike my blood. So I'm gonna spike it. And then I'm gonna put it down, and then I'm gonna keep this one clamped the whole time, and then I'm gonna unclamp this one, and then I'm gonna set up my rate in the machine. So the first 15 minutes we're gonna set it to from 1 to 5 milliliters per minute. And that's because in the first 15 minutes, the patient is prone to have an allergic reaction or immune response to the blood product. So that's the reason for setting it that way. After those first initial 15 minutes, we're gonna set up the rest of our blood product to whatever our calculation gave us for the remaining of the infusion. So we just keep assessing our patient, make sure he doesn't have still no allergic reactions, and that's it.